How's everything going?
Safe, comfortable, and effective periodontal technology. A highly trained, motivated, and friendly staff. Responsibility and integrity. These are the hallmarks of the periodontal practice of Dr. Lee Sheldon. Dr. Sheldon is known and respected by professionals not only in dentistry, but in all areas of health care. He has served as president of the dental staff at Holmes Regional Medical Center, president of his synagogue, director of the nationally known and award-winning Brevard Study Club, and as a faculty member at the University of Florida College of Dentistry. Dr. Sheldon is the first surgeon in Central Florida to have designed and inserted the latest technological dental implant service called Teeth in an Hour. Through the use of CT scans and computer design, a patient can now walk into the office wearing a denture and leave an hour later with implants placed and with teeth firmly attached. Whether it's the simplest of procedures or the most complex dental implant reconstruction, Dr. Sheldon and his well-experienced staff have been providing it for over 25 years. Here to provide you with an overview of dental implant therapy is Dr. Lee Sheldon.
Hi, come on in.
Hello.
You're going to be on camera.
What's that?
You're going to be on camera.
Release.
Sign a release, that's right. They'll split all the profits with you and all of that type of thing. That's great.
Visual check too.
So let's talk about a tooth, and then we'll talk about an implant, and we'll put a crown in there. That makes sense? And if it doesn't make sense, just interrupt me. So there's a tooth. Okay, so let's assume, and by the way, the gum line is going to be somewhere around here. Okay, so there's the gum. So let's assume now that this tooth fractures in some way. It breaks. So we got a fracture line here, so let me erase that. So now we've got this jagged tooth that's there. Right? Make sense? Good. So now this is broken, the tooth needs to be crowned. So what does the dentist do? The dentist will grind the tooth down to this kind of a shape, probably add a little bit of filling material here so there's something to crown, and grind it down like this. So now that's called a crown preparation. And then, I'll get rid of the jagged stuff here. And so then what the dentist will do will be to form something that's made out of gold and or porcelain that fits over that like that. That's a crown or a cap. Okay? Many of you probably had that done. A crown is done to restore an existing tooth, a tooth that's already there. Now let's assume that this tooth has broken way below the gum line like that. Or let's assume the tooth is fractured right through the middle of the tooth, where it would require a root canal. I'd have to do some gum surgery to lower the gum line so they can crown it properly, remove some bone. That's when you start thinking about, all right, is a crown really the right thing? Because if you have to do 2 or 3 or 4 different procedures on a tooth, each one of those procedures has its set of failure rates. And so let's assume there's a 10% failure rate on each procedure we do. Okay, we're doing 4 procedures. That's a 40% failure rate on the tooth. That's the point when we start to think about doing something else, start to think about doing a dental implant. So the choice very often comes, do we save the tooth or do we save the bone that's supporting the tooth? Because if we save the bone that's supporting the tooth, we can put in a dental implant. If I have to remove a lot of the bone in order to help a tooth stay in place, number one, I might remove so much bone the tooth will get loose, and number two, I remove the bone that I could use to support a dental implant. And since the failure rate of dental implants is roughly 10% over a 20-year period of time, you know, we're looking at risk and reward. So instead, here's that same area. And now the tooth has been extracted. So what do? We drill a little hole. And then we drill a larger hole. And then we drill a larger hole until we have the hole the right size for the dental implant we're putting in. What's made dental implants so predictable? By the way, does anybody know how long we've been doing dental implants? The modern era?
years.
Hey! Where'd you get that? You get a prize. Danielle, were you giving some instruction before I got here? Yeah, about 25 years, exactly right. So, every once in a while I hear, oh, dental implants are experimental. 25 years is a long time for the experiment. We've got very, very good data on dental implants. And anybody who's looking at the research recognizes that dental implants is the most predictable way of replacing teeth, bar none. So part of this is the precision of the drills. We were doing dental implants for 10, 20, actually hundreds of years before 1982, which is when dental implants reached their modern era. What was the difference? The difference was in the precision of the drills. That the manufacturer made drills that were the exact same size as the dental implant. So now I drill a hole which is the same size as the dental implant. We put the dental implant in. The dental implant usually has some threads on it. And we literally screw it into the bone. Part one. Now the dental implant has a little bit of a sleeve on the inside of it that's also threaded. And within that sleeve, you can put on something called an abutment. That's a post, which then screws into that dental implant. Okay? Does that look something to you like a crown preparation? It is. And now the dentist can make a crown over the top of it, and now you have your tooth again.
The first time I came to Dr. Sheldon, it was a wonderful, wonderful experience. I felt so comfortable coming in. Everybody seemed so nice and friendly. And even though I was a little bit apprehensive, I soon forgot all of that because everybody put me at ease.
My teeth in an hour were probably one of the best experiences I've ever had as far as investment, as far as comfort. I can't compare it to my normal teeth because they were so troublesome and have been from day one that I could ever remember. That all disappeared when I had teeth in an hour. The mouth itself, let's put it this way, was not happy with the normal teeth. This has all disappeared. This is probably the most natural, most comfortable mouth I've ever had.